no mother in their right mind will carry this baby to term for 9 months, some experiencing complications, abuses from their spouses, but they still keep this baby, would at the end of it slaughter their child. Something needs to be understood deeper than what we are saying, and that's what we call the postpartum depression. Welcome back again, Life with Nurse Carol. Today we are going to be discussing one of the most common conditions that most of the mothers get after giving birth, and this is what we call the postpartum depression. So today we'll be discussing more of what this is, how it manifests with the different people, and what kind of help you can seek in order to overcome it. So after nursing your pregnancy for 9 months, every mother is looking at the outcome, and that's a live baby. And poop, congratulations, it's a baby girl. Congratulations, it's a baby boy. However, there are some things as a mother that you should know. One is having a baby is a life-changing experience, so there is so much joy to the family. The parents, you as parents, you'll be so excited. You name these kids Boo Boo, you name them Puppy, you name them all sorts of nicknames because of the excitement. And imagine you keep wondering when they'll start crawling, when they'll start sitting, when they'll start calling you mama. It's very, very exciting. But this role also comes with so many challenges. It's so overwhelming and can lead to so many very complications. However, you should know that when this comes in, the worry, the tiring, the overwhelming, it's a normal experience that every mother goes through, and it's very normal to worry about your baby, to have doubts if you're doing the right thing, especially if you're first-time mother. However, we should all note that if your feelings include extreme sadness, loneliness, severe mood swings, and frequent crying spells, you may be experiencing what we call the postpartum depression. It's normal for every mother to feel tired, feel overwhelmed, to wonder if this is the right thing she's doing to her baby. But the extreme of it all is what may be the postpartum depression. And we should all know that this doesn't only affect the birthing person or the mother, but it also affects the surrogates and adoptive parents too. So some of you might think, for you just adopted, you don't know what this means. You don't know what it means to give birth and what. It affects everyone who is in charge of that baby. So don't ignore all other individuals that are included in this care. After giving birth, mothers experience hormonal, physical, emotional, and financial and social changes. And these changes can cause the symptoms of postpartum depression if they are unattended to. So, what is this postpartum depression that I'm seeing, that I'm talking about, that you've heard about? It's a strong feeling of sadness, anxiety, or worry, tiredness that lasts a long time after giving birth. Like I said before, it's very normal for everyone to feel tired, but when this goes on beyond the normal limit, it is termed as postpartum depression. The feeling can make it hard for you to care for yourself and the baby. It can also happen anytime after childbirth, and it can start from after 1 to 3 weeks after having a baby. But the sad thing is it can even go up to 1 year. So when you see this mother that is just given birth and they're unable to control their emotions, they are crying all the time, they are expressing their anger, they are unable to take care of themselves, you need to question, why is this so extreme? Is this the postpartum depression that we've heard about? Is there a way we can make this better to attend to this mother and the baby so that she can move on with the roles of motherhood, but also she can be in good health? This is a sad fact that we all need to note, that if you've had postpartum depression before, your risk increases 30% each pregnancy. It's not only for the first time mothers, as people think that, this is your third baby, you should know everything that comes along with a responsibility. It's not like that. Your risk increases every other pregnancy if these situations don't change that induced the first time. You may also experience alternating highs and lows, frequent crying, irritability and fatigue, as well as feeling of guilt that you're unable to attend to your baby. You experience anxiety and inability to take care of your baby and yourself. You find yourself taking a whole day without even bathing. You've even forgotten that this baby needs a diaper change. You've abandoned all other responsibility, not because you're too lazy, but because you feel overwhelmed. Your brain literally can't concentrate on what is right and what order this should go. So when you see these things happening, don't say, this is not your first time. I've told you this before. I don't know why you're overwhelmed. You need to intervene and know that this mother could be going through postpartum depression. These symptoms may not be the same for everyone. Not everyone will cry, not everyone will feel irritable, but these can range from mild to severe and may appear a week of delivery or gradually up to 1 year, like I've said. So you just need to know the signs and symptoms. Some will have most of them, some will have a few, but they will inhibit the way they take care of themselves and the baby. This is the good news. Having postpartum depression is not your fault. Not your fault, and you should never be ashamed of sharing with someone who can help. You need to seek medical help. You need to seek social support. You need to share with individuals that have ever given birth, maybe those that have undergone through postpartum depression, so that they can tell you on how to intervene and how to get better to take care of yourself and the baby. And you should all know that this will be well. So don't lose the hope. What are the major causes and risk factors of postpartum depression? One, having a family history of postpartum depression increases your risk. The hormonal drift. We know that during pregnancy there is an elevated hormonal increase of estrogen and progesterone. However, after giving birth, these hormones drastically change, and this also can push you into alternating mood swings because your body is trying to cope with the changes in the hormones. Physical or emotional or sexual abuse postpartum. This is really very serious because while this mother is trying to get hold of herself to take care of the baby, take care of herself, take care of all other activities that she's been doing, if this person is sexually, emotionally, or physically abused, you're pushing her further to something that she can't handle, and so you increase her risk of being depressed. Having a history of depression, for example, if you've medically been diagnosed with depression, after giving birth, you are at a very high risk for postpartum depression. And as your doctor should be telling you during pregnancy that the first 2 weeks are very crucial to keep your mental health in check. And most of the doctors that have been supporting, if you've been sharing with your obs-gyn doctor and you've told them that you've been on antidepressants, they are able to help you navigate the postpartum period either with a medical relief or by helping you seek the help that you need. Having other diseases like diabetes, heart diseases, hypertension, first of all, these diseases alone can push you into emotional incompetence. I should just say that you're stressed about that disease, and then there's this new responsibility that's overwhelming that comes in place. So this also may push you into postpartum depression. I've highlighted the limited social support. I think this is really very important because it's within our means. It's within the roles and responsibilities of the partners that are around this mother. Because you think she's given birth by vaginal delivery, that's very normal. My mother used to give birth and even go to the garden in the afternoon. and everyone is quite very different. And so you need to look out for your partner specifically. Don't just generalize and say, my aunt told me that if you overcare for the woman, she will get spoiled. This is not an experiment that applies to all. Every person is quite different, and you need to handle them and support them quite very differently. While there are those that can step on their feet immediately after birth, some people may take some time to get on their feet. So you need to analyze the situation as a partner, as a parent taking care of this mother, and anyone who is around this person. You need to ensure that you provide the support that they need. Being a young or single parent, I remember I got married at 24, gave birth at 25. It was so overwhelming. You're used to being taken care of, and then there's this very little being that literally slips off your fingers when you're bathing them. The basin lip seems so big. You're trying to hold them with two hands, but then the other hand has to bathe them. It is so overwhelming being a young mother or even a single parent, because we need the support from the partners. As single mothers, that partner has disappeared because you told them you gave birth or you're pregnant. This is really terrible, and you need to monitor these parents very closely. Having a baby with special needs or who cries a lot. Special needs may be a baby who was born with a disability, like hydrocephalus, those babies with very big heads, a baby who is lame, a baby who has something that's not normal. Those babies need extra care. Those babies' care can be extremely overdraining to the person who is in charge. And if this mother is compromised in any way and they're not getting the support that they need, this mother is at risk of getting postpartum depression. A baby who cries a lot, oh my God. I've had a baby who cries that doesn't want to be held by any other person. As a first-time mother, I used to actually cry alone because I just didn't know what to do. You try to breastfeed, they are crying. You give them this, they are crying. You try to sing, they are crying. You're sleeping, you can't get the sleep. The baby is literally crying their lungs out. It is so overwhelming. Pregnancy complications. It said that when you had pregnancy complications, they are very high risk of you getting postpartum depression because you've carried on this sadness, this sadness that you've had during pregnancy. You're overwhelmed already with a pregnancy, and then poop, you think you're going to get a relief. There is this extra new role that is going to mask still the complications. So you need to support these parents. Breastfeeding difficulties. Well, some hospitals take the initiative of teaching the mothers of breast attachment, the complications during breastfeeding, the options of breast milk. Some people don't. Once you get the baby out and they've done their part, you've paid their bill, that's where their role stops. So this mother goes back literally, and they're struggling on how to feed this baby. They don't know the nipple attachment. They are getting breast sores, and everything becomes so frustrating for these mothers. So we need to take concern when it comes to that. Signs and symptoms. How do you know that you're experiencing postpartum depression? You see some of these signs and symptoms. If you're the caretaker and you're watching this, you need to look out for this and try to relate with your partner. Are they experiencing this? Is there more to this than what I'm seeing? Do I need to seek help? So you need to know them. One is feeling extremely sad. You feel ashamed of yourself. You start feeling guilty, like you failed. You start comparing yourself to the abilities you had before and after having this baby, to your body shapes that you had before and after getting this baby. And sometimes that will throw you into a feeling of shame. You start feeling you're failing to control how you look. You're failing to control the house, how it's organized. Sweetheart, you can't do it all. After giving birth to a baby, give yourself a break and know that there is some extremely important task that has come on board that you need to first attend to before anything else, and that task is yourself and the baby. 2. The feeling of constant panic or scared. Anything small, you're overreacting. The baby starts crying, this, and then starts saying maybe they have cancer, maybe there's something in their stomach. Something small drops, you feel it's your baby. Anyone talks loud, you feel they are shouting at you. That feeling could signal postpartum depression. Severe mood swings. This time you're extremely happy, the next time you're crying, the other time you're shouting, the other time you're doing this. Those are all symptoms. Extreme exhaustion. This is expected, but if it's extreme that you can't take care of yourself and the baby and anything else, whereby it will compromise your eating, compromise anything that you're able to do, this is worrying. Eating a lot more or a lot less than normal. Some people cope by overeating. Some people cope by not even eating because they feel they have to finish all these tasks, attend to this. They want everything perfect. So you don't create time for yourself to feed, neither to feed your baby sometimes, and you're just busy running around, running about, and this can be compromising to your health. Gaining or losing weight. The more you eat postpartum, the more you gain. The more you avoid the eating because you're running around this and that, you lose the weight. Some people may experience trouble sleeping, or some may sleep too much. These are all signs of depression. The extreme of sleep, having no sleep or sleeping a lot, those are signs of depression. And if you see a mother who is just had a baby and they're experiencing that, you need to monitor more to look for all other signs and symptoms and see if they need any kind of help. Trouble concentrating or making decisions. You find that this mother has this baby, the baby is crying, but because they are not in their proper mental health, they are unable to see that. They are unable to realize that the reason why this baby is crying is because they need a diaper change. Or the only thing you can do to feel better is to go and take a bath. They lose that ability and they are just left there. Sometimes you see them busy moving up and down, but there is nothing they're actually completing or accomplishing in that day. Struggle bonding with a baby. Postpartum, some mothers will neglect their baby. It's not intentional. It's not natural for a mother to give birth to this baby and then neglect it. So if you see a mother who has just given birth and the baby is crying, but she seems to be on her phone, like she doesn't care, that is natural and you need to seek help for her. To the extreme is thinking about hurting yourself or the baby. When this is overwhelming, you see that picture that I've shared? This woman is extremely overwhelmed. She feels like she's done it all. She doesn't know what to do. Maybe the best thing to do is to get herself or the baby out of the picture, or to hurt herself. Will this pain stop? Or to do anything to make it feel better, but of course she will not feel better. The suicidal thoughts. When your brain stops functioning the normal way, you start feeling like, maybe if I got rid of this baby, I'll get some bit of relief. Maybe if I did this to myself, I'll get some bit of relief, because it has now turned out of just exhaustion and overwhelming. It's now emotional pain that no one seems to be understanding. But to this mother, they think you understand what they are going through, and they want to put it practical to your face that you need to do something. You need to see this pain that I'm going through and you need to act. But instead, the people around them are unable to recognize the signs and symptoms. Also, recently, we've had so many mothers hurting their babies, like the recent paper that I was reading, where a mother had to slaughter her baby because the the father to the baby failed to send her some money to take care of themselves. To this mother, while you're busy judging her, to this mother, she thinks, without me doing something very drastic, and that's her brain, what her brain is telling her, that father will not see that I'm in pain, that I'm going through whatever I'm going through. So maybe when I had this baby and get this out of the way, everyone will notice and come to my rescue. So as a medical worker, when I read such things, I'm not exactly in a hurry to comment or to judge this person, because no mother in their right mind will carry this baby to term for 9 months, some experiencing complications, abuses from their spouses, but they still keep this baby, would at the end of it slaughter their child. Something needs to be understood deeper than what we are saying, and that's what we call the postpartum depression. Does postpartum depression affect your baby? The answer is yes. Postpartum depression will compromise your care and for the baby, because you're overwhelmed with finishing this task, finishing that task, unable to make clear decisions. You compromise the care of your baby. This will also lead to you skipping up postpartum checkups and reviews, both for yourself and for your baby. And this may include vaccinations. So you're not able to attend to them, but you're also not able to take to the medical doctors so that they are able to attend to them. Depression can also make it so hard, like I've said, to bond with your baby, because you lose that love, you feel that you lose that attachment. Instead, you're too busy thinking that this is now a punishment, you're too busy criticizing yourself, you're too busy being self-conscious about your body weight. You may lose your attachment to the baby. It may cause the baby not to breastfeed. Like I said, breastfeeding difficulties are one of the causes of postpartum depression. When you start getting nipple sores because of the poor breast attachment, this may not be sustainable. The pain is really too much. You can share your experience. It is so painful that you don't even feel like putting that baby back. And in the long run, this mother will just choose to go to formulas, to choose normal milk, which may not be as beneficial to the baby as breastfeeding. This baby may get limited or compromised medical care as compared to the normal, and I've already said, like vaccinations. You're busy running around and you remember, oh, I was supposed to take this baby last month for vaccination, or you take them 2 weeks late. That will not be good for your baby. Your baby may also have learning or behavioral and development problems and mental health conditions later in life, because they've grown up around this person who is going through a lot. They may not get the care they need and attendance that they need. So in the long run, it may affect their mental health. Examples of negative thoughts and feelings. One is having doubts that you can be a good mom. We all get that, but if it goes to the extreme, you need to watch out. Putting pressure on yourself to be a perfect mother. You want a very clean house. You want laundry to be done on time. You want to remain in the best figure. You want your skin to keep glowing. You want your baby to put on the best colors. If she's a girl, in pink. Oh my God. You may not manage that. So don't put pressure on yourself. Feeling that you're no longer the person you were before the baby. That's very common, but if it gets to the extreme, you need to watch out. Feeling that you're less attractive after having the baby. Of course, you have the postpartum belly, that fat that doesn't easily shed off. People, we are going through a lot. There is so much that is happening in our bodies and around us that we don't want to be reminded of those things. So the best you can do as a partner is to support that person. Know that this is a very delicate time, and that this person needs all the support they need. If you want them to lose the weight, find a way to package it, find a way to enroll them to gym, find a way to teach them postpartum exercises that they can keep in shape. Having no free time for yourself, that's not a good thing. Feeling tired and moody because you aren't sleeping well and getting enough sleep. As we close up, help and hope is on the way. You don't have to lose faith. You don't have to feel like this is the worst you can ever do. You don't have to feel like this is the last baby that I'll have. I can never do this. Let me kill this child to prove a point. There is hope and there is help on the way. One, you need to seek for social support from your spouse and relatives. If you don't have a supportive husband, you can seek help from your mother especially, or any sisters that you have, or any kind of friends, so that you're not left alone, so that you don't feel like there's no one that can take care of you. So while the other person is taking care of the baby, you're able to take care of yourself this side. Second, if you identify the above signs and symptoms, please seek help. Counseling, therapy sessions with mental health professionals can help you understand and cope with your emotions and challenges. Third is to join support groups of others experiencing postpartum depression, and this can give you a better understanding of how you're feeling, but it also can give you the comfort that you're not alone going through this. Self-care. Taking care of yourself is very important, and this will include eating all the meals on time, simple exercises, resting when the baby is asleep, and if you haven't gotten a maid already, please consider getting a maid, because you need rest, you need support, you need someone to help out with all other chores that you used to accomplish while you didn't have a baby. Again, I want to say thank you for sticking by. Thanks for watching. It's always Life in Nance Carol. I'll bring you facts about life. I'll bring you medical perspective and how best you can manage this. If you haven't hit the subscription button, this would be the time. Love you all.